Hello, welcome to the MBQuip Abstraction Training video sessions. In this session, I'll be discussing how to abstract the outpatient AMI measures. We'll go over how to determine your population for the measure set and discuss some of the data element questions you need to answer for the measures. This is the AMI measure set section of the CMS Hospital Outpatient Quality Reporting Manual. In this session, I'll be using the version of the manual for use starting with Q1 2020 encounters. If you don't know how to locate this page, video 2 of the training sessions goes over how to locate the specifications manual on the CMS QualityNet site. These two measures make up the AMI measure set. They are OP-2, fibrinolytic therapy received within 30 minutes of ED arrival, and OP-3, median time to transfer to another facility for acute coronary intervention. It doesn't matter if you don't give fibrinolytic therapy in your facility. Okay, this is one of the measures. When you abstract for a measure set, you abstract for both of the measures in that measure set. So when we'll show you how to determine your population. That's the population for the AMI measure set, and those are the records that you submit for your AMI population. Now this section describes the measures in detail, but because this session is about abstraction, that's what we're going to focus on. So your first step in abstraction is determining your population. So your population for the measure set. And what we mean by population are which records do I need to abstract. So in this section, we're going to scroll a bit, and this is all information you can look at, like I said, on your own, because we're just talking about the abstraction. This is where you find out about your population. It's these data elements, but this is the meat of it right here. Patients seen in your hospital emergency department, so they have to have an E&M code that's in this Appendix A, Outpatient Table 1.0, which I'll show you in a minute. They're included in the AMI measure set if they have discharged or transferred to a short-term general hospital for inpatient care or to a federal healthcare facility. So this means a discharge code of being discharged or transferred to another acute care facility. If their age is greater than or equal to 18 years, and if they have an ICD-10-CM principal diagnosis code for AMI defined in Appendix A, OP Table 1.1. And we'll show you that in a minute. We're talking about principal diagnosis code. So this is diagnosis code on discharge. So where do you find that appendix? This is in the specifications manual. Okay, there's an appendix. Here's your E&M codes. So E&M codes are given on emergency department encounters. They aren't a part of the quote-unquote record, so you might have to find that out from your business office or have someone get that information for you. But patients, they have to have had an E&M code. This means they were seen in the ED for this abstraction. One of the requirements. And then here's your table of ICD-10 codes. Okay, this right here. If they have one of these codes at discharge, they're 18 years of age or older and were discharged or transferred to another acute care facility, back here, meet those requirements, these are the patients that you abstract. That's your population for the measure. These are the records that you abstract and submit to the QualityNet warehouse. Okay. The answers to the data element questions that we're going to go on and look at, that's what determines if your case passes or fails or is excluded from the measure. You don't remove cases from the population. Anyone who meets these three requirements are is the case that would get entered for your AMI abstraction. Now, you might think that you have a large number of cases. If you think that you do for a quarter, you might be able to sample. Now, in the specs manual, there is a section called population and sampling. If you think you have a large enough number of cases, you would need to go to the population and sampling section of the outpatient manual and look for the sample size requirements for this AMI measure set for OP-2 and OP-3. But critical access hospitals tend to have smaller amounts of AMI cases and usually don't meet the sample size requirement, which for these AMI cases would be more than 80 cases per quarter. So we're not going to talk about sampling in this session. But again, if you think you have that kind of a number of cases, go to the population sampling section, and that would help you to determine whether you would be able to sample. Otherwise, again, you do every record that meets these requirements. So once you've determined your population and you're ready to abstract, what does that mean? Okay, so there are questions that get answered on each case in the population, which will determine how your hospital is performing on the measures. So to see the data element questions for the measures, the easiest way to pull that up to show you is I'm going to pull up the CART paper tool. Now, you can see session 3, which is describing how to find CART, which will show you how to find the paper tool. Now, you don't have to be using this paper tool. You don't have to be using CART. You can be using a vendor tool. Maybe your data gets pulled directly from your EHR. It doesn't matter. These are the abstraction questions, the data elements for the measures. They are going to be need to be answered no matter what method you use to submit that data. Okay, so you'll see there are questions here, but where do you go? Where are your instructions? How do you know how to answer these questions? That's the data dictionary section of the outpatient specifications manual. And again, if you aren't sure how to find the manual, that's training session 2. It tells you how to locate the manuals. But we're going to look at a couple of the questions, and then I'll show you how to find the instructions, so you'll know how to answer the questions correctly. So let's just take this first, we'll take the second one here. What was the earliest documented time the patient arrived at the outpatient or emergency department? Okay, I mean, it kind of seems simple. What time did they arrive? But, you know, when you start abstracting and you've never done it before, you need to know what do we mean by arrival time, okay? So we're going to click on here, and this is how the data dictionary is set up. This is how it explains what are the instructions. What was the earliest documented time the patient arrived? Okay. So I'm not going to read everything for you. You can do that yourself, but it's notes for abstraction that give you the instructions on how to determine that. Okay. Look at these, gives you some examples. What might work, what might not work. What happens if the patient maybe came from observation. But I'm scrolling down to where it says only acceptable sources, which means that the only place that you should be looking, or your EHR should be pulling for you, if someone is setting you up a report to do that, this is where you should find the only acceptable places to find that information, and that is the emergency department record. So it can come from the face sheet, the consent forms, any ED reports, anything that's part of an ED department record. Okay. So these are acceptable sources. Any of these sources can be looked at to find the information to answer what was your arrival time. Okay. They don't want you to look here. I don't know if anybody has these stamps or addressographs anymore, but okay. No pre-printed times on a vital sign graphic record. That's not acceptable. So this is what the instructions do in this alphabetical data dictionary for you. Okay, so that was arrival time. Here's some of the other things. They're not difficult. I'll let you look at those. I just want to hit some of the ones where I know that people have some difficulty with. And here's another one, discharge code. Okay, you want to look and see, because if you look here, when you look at your choices, oh, here's home, here's all the different acute care facilities, other healthcare facility, well, what's that? Okay, again, let's go to the alphabetical data dictionary. You're looking for discharge code. Okay, what was a patient's discharge code from the outpatient setting? Okay, don't go by the billing code. Okay, you need to look at this record and find out from narrative or however it's documented, where was this patient discharged to? Tells you what to do if sometimes you see more than one discharge status, and that happens. Okay, tells you which one you should pick. Tells you what your data sources are. Tells you what's excluded. Don't look at the billing code. Okay, but this is the most important part for this one. It tells you what fits in the different values. Now, if you remember value 1 back here, sorry for scrolling, but that was home. So what fits into home? Assisted living facilities, if they went to prison or jail. Okay. If they went home with home health services. Okay, this is home. Okay. Value 3 was hospice. Okay. Value 5, this is the other big area where people make a lot of errors. Go back and look at value 5 is other healthcare facility. What's included in other healthcare facility? Again, sorry for scrolling, but other healthcare facility is a nursing home, a VA nursing home, a long-term acute care hospital, a rehab facility, a skilled nursing facility, a swing bed. These are this is the facilities that fit into value 5, other healthcare facility. Okay. Now, if you have a patient who goes to the nursing home, maybe they live in the nursing home, then they're seen in your ED and they go back to the nursing home. They are not going home for abstraction. Nursing home is not listed under value 1 home. Nursing home is listed under value 5. So if you have a patient who is going to the nursing home, but your billing or your hospital is coding it as home, that is incorrect for abstraction. Your discharge code should be other healthcare facility. Okay? Because nursing home is not listed under home. The other things, again, we'll skip by some of them that I think are easier to find, but here's another one. Really gets down to the clinical part of your AMI patient. Is there documentation of ST segment elevation on the ECG performed closest to emergency department arrival? Yes or no, but, I've been doing this for a long time. I don't just know how to answer yes or no on this. You need to look at the instructions for this one. This is initial ECG interpretation. There are about 4 pages of instructions on how to answer this. And it tells you there's a methodology. There's a step-by-step instructions. Identify the ECG performed closest to arrival. Tells you how to do that. Start with the review of the sign tracing, because maybe you have more, you've got more than one. You're going to pick the closest to arrival, but we want a sign tracing. Tells you what to do if there's no sign tracing. Or if you don't find an exclusion word, you have to step by step go through this to figure out how you answer when you answer yes or no correctly. There's all these notes for abstraction. All of these bullets are to help you. Let me just, if you listened to the session where we talked about the manuals, here's an example of highlighted in yellow. that means that this is new to this manual, new to this version. It wasn't in the past version. So this is giving you some more instruction. It always tells you your suggested data sources. You can look at the ECG report or the emergency department record, narrative of the physician talking about the ECG. And you know that from reading the bullets. And these are inclusion terms. These are inclusions terms that would mean yes. Then you could say yes if you saw these. But these are exclusion terms. If you see any of this documentation, then the answer to that question is no. So you've got to read through all of these instructions to correctly answer yes or no for this. Okay, I think this is a really good one. I like to show this to people who maybe don't abstract, who don't understand why sometimes it takes a while. But this isn't something that you could just pull from your EHR because look at all those instructions. I don't think there's going to be a data field that would specifically be able to answer that question. So there's all of those instructions that you have to read to figure out, was this a yes or was this a no for ST segment elevation? Another one that people have some difficulty with, it's this one. Was there documentation the patient was transferred from this facility, so from your ED, to another facility for acute coronary intervention? I want to look at that one. Again, sorry for the scrolling, but it's the best way I can pull these up for you. Transfer for acute coronary intervention. Okay. Was there documentation the patient was transferred from your ED to another facility for acute coronary intervention? You've got three options. But look at the notes for abstraction. To select value 1, so the patient was transferred specifically for acute coronary intervention, the documentation must include a specific defined reason for transfer, such as they're going for percutaneous coronary intervention, they're going for an angioplasty, they're going for cardiac cath, they're being sent to the cath lab. Okay. The inclusion guidelines for abstraction is not an inclusive list. If the acute coronary intervention is not listed in the inclusion guidelines, but it's a defined reason for transfer, this is sufficient to abstract 1. Okay, so here's some of your inclusions. They could be going for an angiogram. They could be going to the cath lab. They could be going for PCI. Okay, but there has to be, there has to be a defined reason. There has to be a defined reason they're going for an acute coronary intervention. So if your record says transferred to cardiology, transferred to General Hospital's cardiology, or you just know we always transfer our heart patients to whatever hospital, okay, that isn't going to be, you can't answer 1 for that. You have to see documentation that they're being sent for an acute coronary intervention. Otherwise, you're going to record this as 3. The patient was transferred for reasons other than acute coronary intervention. So just that you're transferring them to a cardiology floor isn't enough to say value 1. And the other thing, you've got departure time. Okay, what time did they depart the ED? And again, maybe that kind of looks like you should be able to figure that one out easily. But you've got some instructions. We want the time, sorry for scrolling again. You want the time, the intent is to capture the latest time at which the patient was receiving care in the emergency department. Okay, what was the last time they were under the care of the emergency department? So you've got some instructions, because what you want is the time the patient physically left the department. Maybe not the time they were, the physician put his order to leave, the time that they physically left the department. Like it says, don't use the discharge order, because that might not represent the time the patient actually left. So you've got instructions, okay, on what's acceptable. Okay, what to do if they're going to the observation from the ED. You've got some verbiage that is acceptable. These would be okay. But don't take these. these are words that are excluded, not acceptable. Okay. All right. So let's recap. First thing you want to do is determine your population. Okay. Then these are the questions that you have to be answered, the data elements that have to be provided for your AMI cases. And to know how to correctly answer those, or to correctly, to get the correct information for these data elements, you need to look at this alphabetical. I'm saying alphabetical because it's in alphabetical order, but the data element listing. This is where you find the instructions. So now, whether you are abstracting yourself, you're going in the record or pulling these out, or if data is being pulled directly from your EHR, it's your responsibility to make sure the data that's being pulled is from the correct data fields in your EHR. The instructions how to answer the data element questions must be followed for you to be pulling accurate information. Okay. Because sometimes, and I don't know why, because different people enter different things in the record, you might have several times for arrival time or several times for departure time. I mean, even though, the patient leaves the ED once or the patient arrives just once. So if you've got a record where you've got different people entering that data, you have to, as the abstractor, or figure out by these instructions which time here is the one that we're looking for, which follows the instructions. If this is being pulled from your EHR, you've got to sit down with the person who has developed that program, or to decide how, whoever's making that decision, that's this data field, this is the field we're going to pull that information on. Is that the correct field? Is that really, the time that the patient physically left the ED? So regardless of how this data is being pulled to be sent to QualityNet, it's your responsibility to follow these instructions to make sure that it's being done correctly. So if you have any questions about the MBQuip program, here's where you can find your StateFlex coordinator if you aren't sure, or you can contact me if you have any questions about abstraction. Thank you.